Back now on Triad Today. Very pleased to have a very distinguished physician surgeon with us today, J. Paul, our director, if we can see, and meet Dr. Jason Huff. He's an oncologist with Emerywood Hematology and Oncology. That's a Cornerstone healthcare practice. He's here courtesy of the good folks at Triad Federal Credit Union and High Point Regional Health System. And we are so glad to have you here today to talk about cancer. How you doing?
Thank you. Thank you. I'm doing well.
Where were you born?
I was actually born in Sumter, South Carolina.
Oh, yeah. Very rebellious area of the country. Civil War rich in history there.
That's right, yes.
Were you a rebel as a kid?
Actually, we were there for 2 years, and we went back to Nebraska, where my parents were originally from, and I grew up in the Midwest the rest of my life.
All right, so not rebellious. Midwest is not rebellious.
No, not at all.
Why did you, I'm always curious when I meet a physician for the first time, why did you decide to go into medicine?
I have always been interested in science, and my father's actually a veterinarian.
Oh, okay.
So I sort of grew up in his clinic, working on animals, looking in his microscope, and just cleaning up after the cows and the pigs and everything.
So he did large animals as well as small.
Yes,
yeah.
he was both, and so I quickly decided that animals weren't my forte. I didn't like getting into the dirt too much, so I decided to go into medical school.
Yeah, that's a fascinating story, and I know your dad's proud of you. What kind of special training? I don't think I've ever asked this of an oncologist, and we've interviewed several over the years. What kind of training do you go through to become an oncologist as opposed to just a physician or urologist or whatever?
That's a good question. After medical school, we actually go in and do a year of internship in internal medicine, and then do a 2-year residency, and then after that it's a 3-year specialty. I'm both a hematologist and a medical oncologist. So
and that's what took 3 years?
Mm-hmm. So it was an additional 6 years of training after medical school.
Okay. Now what types of cancer does your practice treat?
We are a general medical oncologist and hematologist. We treat most all cancers. We do refer out aggressive leukemias, lymphomas, and lymphomas to our surrounding tertiary care centers because they have such good specialty care there. But for the most part, we take care of almost everything. Each one of us has kind of our little special interests. Mine specifically include cancers of the gastrointestinal system, esophagus, stomach, colon, pancreatic, and then also lymphomas.
Right. And how many folks in your practice?
There are 5 of us total.
So you really cover a lot of ground then with those specialties.
We do, yes.
How have diagnostic tools, I mean, we've all heard of, mammograms and various, CT scans and MRIs. How have diagnostic tools used to detect cancer specifically changed in recent years for the better?
Well, I can tell you that in the 10 years that I've been really seeing patients and playing an active role in patient care, that we've seen a significant improvement in our imaging, CT scans, high definition scans. Now with the advent of digital mammograms, MRIs, PET CT scans looking at the metabolic activity of certain parts of the body, we've been able to see and detect things at a much earlier rate. And there are studies ongoing using those types of imaging techniques to try to catch cancer specifically at an earlier stage and increase the cure rate and the treatment.
What are some of the advanced treatments for cancer that you're optimistic about, that are either right almost here or on the horizon or whatever?
In medical oncology, many people think of us as being the chemotherapists. We're the guys that give the chemotherapy that makes your hair fall out, makes you nauseated, you don't feel good. Since the year 2000, and I kind of keep going back to that time because this decade I think has really become a renaissance for medical oncology. We've come up with, or scientists, I can't say we, but scientists have come up with more focused treatment options that are actually targeting cancer now. The chemotherapy is still used quite frequently in treatment of cancer, but these new targeted agents are actually seeking out and able to pick the cancer off rather than harming the entire body.
Yeah, instead of being so toxic in the treatment itself.
Right.
We have just a minute left. Very quickly, what's the best overall plan for avoiding cancer? And I know there are lots of cancers, so you can't be specific, but overall.
Well, don't smoke, eat right, exercise, and then follow your physician's advice about screening tests, colonoscopies, mammograms, routine blood work periodically. I think those would be the best.
I want to get you back sometime if we could and talk about some specific cancers, but on screen right now, Emerywood Hematology Oncology there in High Point. The number is 802-2500. That's up on screen. Also the logos for Triad and High Point Regional, and thanks to them and to Cornerstone Healthcare. And will you come back sometime?
Absolutely.
Doc, thanks for everything.
Thank you.
All right, we'll be right back.